A very big hello to all my dear students. So, how are you all? Welcome to the T2O series in your favorite channel, You and I with Dr. Ruchi Rai. So, we had some interruptions in our alphabetical series. We were discussing some rapid fire discussion was going on for the FMG exam. Back to our alphabetical series in which alphabet? Today it is N, right? Okay, any guesses? What are we going to discuss? Yes, myotonic dystrophy. So you all know myotonic dystrophy is a myopathy. You can read it more nicely in your medicine. Ocular point of view, what are the ocular features we learn with 5 P's? And what are those 5 P's? One is ptosis as a part of myopathy. You can get ptosis. Number 1, pre-senile cataract. Which one is this one? We have learnt already. We are talking about Christmas tree cataract. Right? So pre-senile or Christmas tree cataract. Intraocular pressures are generally found to be low. Pigmentary retinopathy. Okay, the same salt and pepper like picture, pigmentary retinopathy and miotic pupil which is reacting slowly to light. So these are the ptosis, pre-senile, pressure, retinopathy, pigmentary and pupil. These are the 5 P's of myotonic dystrophy that you will learn. If you want to learn it in my way, you can also do one thing. If this is difficult, we make a simple diagram, right? And now things are going to be very easy. So if you talk about what are the features, I hope I've made this diagram so many times. Dotted line is the retina, uske piche choroid, this is the sclera. So if you now learn outside to in, first is ptosis in the lids, we just mark it here, ptosis, right? So this is your ptosis is number 1 feature on the diagram. Of course it is. Then second, you can say low decreased intraocular pressures, right? Then you can talk about pre-senile cataract out here, pigmentary retinopathy here, right? So this way you will never forget any feature of any condition, ocular features, if you learn in this way, right? And of course, pupil is slowly reacting and miotic pupil. So let's label it and learn it. It's easier. Okay, so here we are. This is what is Christmas tree cataract. It's a pre-senile cataract. Okay, pre-senile means before old age, before 50 years, the patient can present. What are the other pre-seniles you have learned? Diabetic cataract and atopic dermatitis. Remember that. Okay, so let's solve this question. Oil droplet cataract is seen in. Why oil droplet cataract is seen in? Of course, we know galactosemia. I think I have just included this by mistake. It should have been Christmas tree cataract. Maybe I must be intending to include some other question here. It's okay. You know what it is, right? So I'm not going to change it or re-record it. हो जाता है कभी कभी. So oil droplet cataract of course is galactosemia. Let's revise it further. Down syndrome में कौन सा पढ़ते हो? Blue dot cataract. Let's go to this question only, right? Lenticonus, I hope you have revised with me. Anterior lenticonus Alport syndrome and Waardenburg syndrome. Posterior lenticonus, it is Loeys syndrome, isn't it? So I think this is good. And of course, keratoconus, we don't learn any cataracts there. We know that, right? Oil droplet reflex is a feature of keratoconus. I can add to this, right? Okay, so that's for today. Thank you so much. You must have enjoyed the session and you must have also enjoyed the mistake that I've made. Anyway, we have created more information from this mistake, isn't it? Okay, thank you so much. Stay blessed and keep smiling. I'm going to put it the same way in the Hindi version as well.